Have you ever stopped to think about what's actually inside a psychiatric file? You might picture just a bunch of medical notes, right? But it's so much more than that. It's an attempt to map out the most complex thing we know, the human mind. And sometimes that file tells a story with two narrators who are saying completely different things.
And that's really the question at the heart of what we're digging into today. What happens when a mind isn't just dealing with its own well-being, but starts grappling with the very fabric of the universe itself? So we're going to look at one person's life through two totally different lenses. First, through the clinical, detached observations of doctors, and second, through the intricate, philosophical world that this person built from the inside out. Okay, let's dive in.
First up, let's build the picture of an individual named Johann, but seen strictly through the eyes of the medical system. This is the official story, the one that's told in the language of diagnoses and clinical observations.
The official story starts really early. We see an autism diagnosis way back in the second grade. Then there's a really critical moment when he's just 13, a 3-month hospital stay for what the file calls psychotic functioning. Fast forward a few years to 2016, and there's an assessment for involuntary admission. And from that point on, we see a consistent record of treatment with antipsychotic meds.
Now, this is the language used to describe Johann. The file uses terms like autism spectrum disorder to talk about his rigid thinking, but it also gets into these episodes of psychotic functioning, using some really powerful phrases like megalomaniac and paranoid delusions, and then later the label of schizophrenia gets applied. You can see how this vocabulary paints a very specific, very clinical picture of a mind in serious distress. Okay, and now we're going to completely shift gears. I mean, a total 180. We're leaving the language of the clinic behind and entering the language of the cosmos. This is Johann's world, in his own words, a world he documented so carefully because he just wanted to be understood. You see, this isn't just some passing thought for him. It's a core belief. Johann isn't just living in reality, he's taking it apart, piece by piece, and theorizing about how it's all put together. He's literally building his own system of logic to make sense of what he's experiencing.
And here's where you can really see him trying to build that logical framework. He writes that the universe is expanding because of, get this, contradictions between different mathematical dimensions. He thinks that our consciousness actually chooses which parallel universe we live in. He even suggests the mind can directly influence matter. This isn't just chaos, you know? It's a real attempt to create a personal physics, a unified theory of his own existence. And what's so important here is that Johann isn't just pulling these ideas out of thin air. No, he's reading, he's researching. He brings in concepts like the sorting demon from other thinkers to try and explain his own internal process for making choices. He is actively trying to build a bridge from his unique experience to the wider world of ideas. So this is where the story gets so incredibly fascinating, because the file basically has these two parallel stories that often just flat out contradict each other. And it creates this huge gap in how you see Johann. I mean, just look at this. It's night and day. One clinical report says, flat out, the introspective capabilities are limited. But then, in his own writing, Johann says, I monitor my thoughts and feelings 24/7. So, how can both of these things be true? Is one a symptom and the other the reality? Or are these just two totally different ways of interpreting the exact same mind? And this conflict, it plays out in a really dramatic way when it comes to his treatment. The file shows this painful, repeating cycle over and over again. Johann wants to lower his medication because he wants to feel more. But when he does, what the doctors call psychotic elements come back. This causes some distress, so he agrees to go back on the medication. It's this constant, brutal tug of war between feeling alive and feeling stable. And in his own words, you can just feel the weight of that struggle. He feels like the system, while trying to help him, has actually just put him in a box. He talks about this deep feeling of being an object, of being written off before he ever got a chance to help write his own story. So you gotta ask, why? Why write all of this down? Why go to the trouble of creating this elaborate internal universe and documenting it so carefully? Well, the file actually gives us a really clear answer. It wasn't just about explaining his theories. It was about finding a purpose. This might be the most powerful sentence in the entire file. His ultimate goal was an incredible act of empathy.
He was drawing a map of his inner world, not just for himself, but for anyone else out there who might feel lost in the same way. He wanted his own struggle to make other people feel less alone.
And that's what we're left with, isn't it? This final, lingering question. This file is a record of an illness. There's no doubt about that. But it's also the record of a deeply philosophical person trying to understand his own consciousness and his place in the universe. So, where do you draw the line? Where does the illness end and the search for the self begin? Or are they maybe just part of the same human journey?